real pleasure today to have Trey Darnell. So anyway, and he's actually brought with him his sidekick that's already sung for us today so that she can clean up his messes while he's speaking. Trey is a 46-year-old native of Kingsport with deep roots in the community he continues to serve. In 1997, graduate of Sullivan South High School, he earned a bachelor's degree from East Tennessee State University and a master's in law from Wake Forest University. Not a shabby individual. He's a medically retired commercial airline pilot, previously based across the East Coast with New York's LaGuardia Airport as his favorite pilot's base. At the beginning of COVID, he led the Lincoln Playground Project for Abraham Lincoln Elementary School, successfully raising more than $50,000 in less than 100 days to enhance student play and learning spaces. Trey has served on numerous local boards and nationally on the Military Family Advisory Network, contributing to efforts to support military families. His community involvement includes volunteering with his daughter's parent-teachers organization, participating in Kingsport Chamber youth programs, and serving on multiple United Way Greater Kingsport visionary councils. He serves the Kingsport Library Commission and was selected by the Friends in Need Health Center Board to serve as the executive director following the retirement of Alderman Betsy Cooper. In his free time, other than taking naps at work, Trey enjoys keeping the plants in his office alive, supporting Kingsport City Schools, Johnsonville Middle School, and the athletic bands programs where his daughter is a cheerleader and a trumpet player. Please welcome Trey Darnell.
You might wonder how I went from being an airline pilot to being executive director of Friends in Need. And I really don't know how. But I had to medically retire from commercial airline captain due to a medication that I was taking, and the FAA took away my medical certification. I spent a journey of 5-6 years trying to figure out what was next, a spiritual journey, and doing a leadership program podcast for about 2 years. The time had come to stop. It had moved, paced its course, and we were getting ready to start having the same guest again, and set up the last one, and it was Alderman Betsy Cooper. And I'm sure many of you know her and how sporadic she is and chatty. And she was 3 weeks into her executive director position at Friends in Need, and something sparked with me. And I told her I was interested, and she said, "You have a job." And then one day, a couple years later, she said, "I'm retiring," and I said, "I'm going home for the day." But coming up to Friends in Need, I didn't know you were there at the beginning, so I'm going to put you on the spot. Normally, I would tell you what the mission in 2026 is for Friends in Need, but I would like for you to tell the mission at the very beginning in 1993.
This was the day when managed care was becoming mangled care, and there was a whole segment of the population that were working hard and were not getting employer-based insurance. They were the uninsured working people, and we, Tom and Harry and Wes, we all saw that, from family medicine to cardiology to general surgery, and just the need to meet that need, to respond to that need, and that's when it came up. And how do we do it? How do we do it? And we had no clue. So that was the mission. Is that consistent with where it has become?
And that's exactly what we continue to try to do today. And I'm thankful for what we're doing. I'm thankful for Tracy being there. Dr. Eastridge volunteers once a week. Dr. Turner's on the board, and we see Mr. Prock all the time. So it's special what we do, and I love going to work every day. So that's basically our purpose. We serve 8 counties in Northeast Tennessee and 3 in Southwest Virginia. That is a lot of work for our staff. That is a widespread of patients that we have the opportunity to make a great benefit for that are either underinsured, uninsured, or just can't afford a healthcare policy, for instance, on the marketplace. So you might wonder how we are able to welcome patients into our clinic. We have a sliding and fixed fee scale. We're getting ready to start the fixed fee scale to make it a little bit more easy for our staff at the front desk to keep track of how patients are going to pay fees if they're able to afford it. You do not have to have a job to be a patient, and if you can't afford it or you have no income, you do not have to pay to be a patient. You're able to come to our clinic free. So you just have to show proof of income. If you do not have it, you just write on a sheet of paper, I have no income, sign your name. Proof of address, it can be a piece of junk mail. So it could be one of those little plastic keys on a fancy cardstock paper that comes from a used car dealership. So just whatever you have with your address on it, those are really the two things that we need to become a patient at Friends in Need. So how many people work at our clinic? We have our 2 physicians that volunteer. One of those is Dr. Eastridge. We have 3 individuals in the medical department that are compensated. One's a nurse practitioner, one's a registered nurse, and one's a medical associate. So they do a lot of work for very little money and without benefits. We have 5 dentists that are compensated. They are all part-time. One works 3 days a week, one works 4 days a week. Typically, the 4 days come once a month. Dental hygienists, we have technically 2 at one time. One works 3 days a week, one works 1 day a week to keep that consistency. Dental assistants, which work very hard and are cross-trained. We have 6 of those, and we have 6 support staff. Our volunteer force, you can just kind of glance at how many hours there are. And then in a couple seconds, I'll show you how beneficial that is for our clinic in dollars. I almost did the little United Way roll as how they like to share their how much they've raised for that year. But our value is over $100,000 last year alone. So the big thing is how many patients we serve in a year. And I will be honest, in only being open 205 days in 2025, we served in the number of appointments over 6,800. That is roughly 37 appointments a day. And that's people running with their heads cut off like a chicken. So I am proud of everybody. Tracy and I have it easy. And she'll be up here in a minute to share success stories and how we just make a difference. I'm not good with this clicker. So you might wonder how we are able to do this. There are 2 big local organizations that help us. Anybody want to take a stab at who those would be? That's one of those. And I can kind of say COPA. Is that a bad word in this room? Probably. Ballot Health does wonderful things for us. We are able to use one of their facilities. We pay very little rent. It's under $250. We wouldn't be able to do what we do without Ballot Health. They also have what's called a community health navigator that is in our office and actually helps patients with determinants of health if they have food insecurity, if they have transportation, which is the number 1 obstacle for people seeking medical treatment in Tennessee. They also help with job insecurity and housing insecurity. So we do not have to pay for that. Ballot Health covers that. And you're correct, United Way, Mayor Schul and everybody else. We are a partner, and we're proud of being there. So we offer medical and dental services in our office. I'm not sure, dental was not part of the plan in 1993, was it? So it was just medical coverage. So just the typical things you could think of where you would go to your primary care physician. Primary care visits, acute care, chronic disease management, specialty care referral, and for us, we do pharmaceutical assistance, which is actually unique for a charitable clinic. We are able to specialty referral, for instance, orthopedics, urology, neurology. Part of Project Access is the name of the organization. If one of our patients needs to see orthopedics, we refer that to them. It's at no cost. If they need to see a urologist, we refer that at no cost to them. And one thing that's new that was really hard for me is patients were skipping doses of medication, or they were cutting it in half, or skipping days, or just not filling the medication because they couldn't afford it. And that's tough to not be able to afford something that'll reduce symptoms for something, make you healthy, or even stop a disease or complications that you're having. So let me skip one. We were able to partner with an organization called Dispensary of Hope. It cost us a membership each year, but we're able to provide additional medication for these patients at no cost to them, like Eliquis, SSRIs like Vibrid, Rexulti, but no cost to them. 30, 90-day supplies, and it's changed their lives. It's a little expense to us, but it's something that we can offer. So we make sure that our patients do not have to pay anything. So I went back one of the, you might have saw it in the paper yesterday. We are 1 year into a wonderful grant program that we became part of. It's called Heart to Heart International. A year ago, you had to go through a process, 4-step, quarterfinal or regular round, quarterfinal, semifinal, and a final. The semifinal, they come to your clinic and do a walkthrough and interview, all that stuff. So I kind of set up light music in the facility in my office, low lighting to get rid of the fluorescent, to try to make it inviting. Because we made it to the semifinal, we wanted to make it to the final. Our interview went so well. At the end, I said, "What's next?" And she said, "We're just going to go ahead and award you the grant." It was worth a little over $75,000. We were able to provide point of care equipment in her clinic to do laboratory testing. And that provided instant results or within 15 minutes. That improved care rather than having a patient have lab orders and wait for those to be sent to Indian Path Community Hospital, another clinic like LabCorp. We were able to provide better care, as our staff now calls it, great care, better than good care. So we have all the equipment and it's now ours. And I will compliment our staff, not this Tracy, we call him Tracy with it. Oh, that sounded awful.
He doesn't like to compliment me.
Yeah, I love complimenting Tracy, but Tracy with an I at work. She is our clinical coordinator. She does all the data, and we are loved by Heart to Heart International that they provided an additional piece of equipment worth $20,000 to our clinic to do CBC test. that we would have still had to send out for lab work. And what's such a blessing for this equipment, I hope I'm not taking too much time. I feel like it's a Methodist church with a clock on the wall. Is right after we had it up and running, there was a change with the health system in our region from Quest Diagnostics to LabCorp. And with Quest, we received those lab tests at no cost. With LabCorp, there was a cost. It was no longer free. And our patients started getting bills and collection notices, $8,000, $9,000 for a set of tests. And we were unable to get LabCorp to waive those. We were too large of a clinic. So we started covering those lab tests, lab costs. And it was costing the clinic $8,000, $9,000. And with the help of Heart to Heart, and as the timing that came, we've now reduced that to about $1,500 a month. So the average test that we run for a new patient is about $470 sent out to LabCorp. It costs us right around $50 to $60 now, just for the packaging, the draw, and I shouldn't say packaging, all the little test materials. So it is definitely a blessing. And we notice when we need something at the clinic, it happens. So we take good time to say we take medical equipment donations. If you have some that you need to depart with, crutches sitting in a closet, which I had 2 sets of crutches sitting in my closet. I'm not sure why. I guess I hurt myself sometime. But please feel free to donate those. We provide those to patients of ours. We provide those to patients, our individuals anywhere. If they're in Big Stone Gap, we will get them to them. If they're in Wise, we will get them to them. So our new thing is dental. That was not part of the original mission. And we do everything a dental office does, except right now we do not do dental implants, but we're getting ready to. So dentures, we're now 3D printing those, thanks to Dr. Smitty. I'm sure a lot of you know him. We are able to print those due to a long-term loan of 3D printing. And it's doing wonderful. It's reducing the number of visits that a patient has to come into the clinic from about 4 to 5 down to 2, maybe 3, which you hit that transportation issue again. And Delta Dental is one of our huge partners. They do an operational budget or operational giving every year. And if we have capital needs, they will give as well. So it all comes down to finances for a clinic that has 7 dental operatories, which that was so weird for me when I started working. 1, hearing drills all day, and the word operatories. My phone had no idea how to spell it.
I don't think that's a real word.
I don't think so either. Dental rooms. So we have 7 of those. We have paid staff of right around 22. So you're probably wondering how much it cost. It's $1.817 million last year. The majority, we're at a good percentage for payroll, but it's the majority at 59%. Everything else is like dental labs, where we send out for bridges, crowns, things like that. And the good thing is, our revenue, we were in the black last year, but it was right at 1.817. And I will open that up to questions in a little bit. So one of our biggest fundraisers, our only fundraiser right now, is the Bluegrass and Barbecue. And the smart thing that I think they created before I was there is it's on a Thursday night. So you're not worried about going on a Friday night, a Saturday night. So Thursday night, it's quick. I think it starts at 6, doesn't it?
It starts at
5:30, which most people show up at 4. It's like a fish fry.
5:30.
And it's done at 8. There's a silent auction that Don Royston is there bidding on. You haven't left yet.
That's because he's looking at my silent auction item.
That's right. Debbie.
Your silent auction items went well. So it's October 22nd. Tickets are $75. We would appreciate if you come. The band, the Bluegrass Band, is from First Broad Street. It's made up of families from there. And I'm not a bluegrass fan, but it's enjoyable. And I'm going to pass off to Tracy. She's a much better speaker.
That's not true.
She is, and a much better singer.
And now it's my joy to work for Friends in Need. This is my second year there. I'm there because of Trey. We've been friends for a very long time, and I just work part-time, just a few hours a week. But my job, I have the title of development director, but I'm really about community relations and building partnerships, because that is what the organization is about taking care of the community and partnerships with the patients so we can provide what they need. So today my job is to provide a success story and maybe a couple. I'll first tell you about my friend Hope. She works at Bellafina Chocolates. I'm on the board there, and she became one of our patients. She was in a great, Don, where are you going? He's leaving early. I just teasing him. We knew he was leaving. But anyway, thanks for asking us, Don. Hope she works at Bellafina. If you don't know what they do, they make chocolate, but it goes back into children's and women's ministries. So she was a worker there, and she didn't smile very much because she was in pain, and she didn't have her teeth on top. She had a drug problem early in her 20s. She was 28 years old at the time. She had overcome it, and she was working at Bellafina, learning skills to be a good worker, but she never smiled. And what it was is her teeth, the ones that she did have, were rotted out. So she came to Friends in Need, where they did have to pull most of her upper teeth and eventually all of them, and then she has dentures on the top. She was our success story this year for United Way because of the way it has changed her life. If you talk to her now, she smiles all the time. She wears her Bellafina t-shirt in public because she wants to tell about them, and now she's telling about Friends in Need. And actually, her husband, who was a former drug addict, who just got out of jail for being such a bad guy, but is on the right track now. He now is our patient. We got him in unexpectedly. His tooth was hurting, and he's on the path to healing. So what it is, a lot of times, is giving people a chance who might not get a chance otherwise. Another success story from a few years ago, a man that I went to high school with, who was a great guy, smart guy, but he couldn't afford to go to college. So he started at Eastman as a laborer. But years go by, and he says, I can do more than this. I want to do more than this. So he goes to college, and eventually he quits his job at Eastman, and he goes to law school. And I have a son who's a lawyer. L1, the first year of law school, is so hard, and he called me 6 times telling me he was quitting. So this guy, he said that the guy that lives here in Kingsport, his first year, he had a stomach ache the whole year. So L1 is over, but his stomach ache does not stop. But because he is a full-time student, he doesn't have a job, he doesn't have insurance, someone told him about Friends in Need. And he came there and he saw Desiree, who was one of our paid workers, a nurse practitioner, and she said, well, let's do some tests. Eventually, we found out through Project Access, and he had stomach cancer. So his knowing about our clinic through a friend, his coming there, he came in time. He now is well. He now is whole. Instead of being a patient, he's now someone who's a donor, who gives back to Friends in Need. So it's a cycle. It's a bridge. We're there for people when they need us. And when they don't need us, there's still a testament telling people about what we do. And it's also about partnering with people like you. because we can't do what we do without people giving to us. Lastly, I'll tell you, a few weeks ago, our compressor went out, and we've got it rigged, and it's working, but we're, holding it together with thread and hope. But I put out the call on Facebook, and I said, friends, we need your help. Within a few hours, people were calling and giving us little checks and big checks. But God is bigger. See, I'm also a minister, if y'all don't know this. I love Jesus so much. And I know that I'm a part of Friends in Need because we put out the call and check after check, little checks and a few big checks. But we're going to pay for that compressor. Because what our job is at Friends in Need is to care for those who need us most. So thanks for having us, and I'm gonna let Trey answer questions. I'm smart, but I'm more about the loving other people, and he likes numbers. So if you have a question, we'd love to answer it. And thanks for letting us come.
Tracy's passion is pediatric dentistry.
We will have pediatric dentistry in the Tri-Cities.
And
I'm declaring it.
we're in a dental desert in the Tri-Cities, and we have a new dentist coming in July straight out of dental school that she's considering taking 6 years and up. And we're trying to work out where several appointments during the week will be pediatric. And we've already discussed it with KCS, and we're working with Sullivan County Schools to determine which of their students need it the most. So that's in the infancy, and we're hoping to get a full-time pediatric dentist. It costs money.